Neoplasm, also called tumor or oncoma, study of which is called oncology. So, what is a neoplasm? Normally, a swelling like hypertrophy or hyperplasia becomes normal when a stimuli is removed from it. But in case of neoplasm, it persists in the same way even after the removal of the stimuli. So, a neoplasm is an abnormal mass of tissue, the growth of which exceeds and is uncoordinated with that of the normal tissue and persists in the same excessive manner even after the cessation of the stimuli. Now, what are the types of neoplasm according to behavioral classification? They are benign neoplasia, malignant neoplasia, intermediate malignant neoplasia, latent cancer, dormant cancer, occult cancer, and carcinoma in situ. Among them, benign and malignant neoplasia are important, and the difference between them is benign neoplasia is well differentiated, but the malignant neoplasia is undifferentiated. Here, differentiated means how much does the cell and the structure of the tumor resembles and matches with the cell and structure of the original tissue. Second is pleomorphism is absent in case of benign neoplasia, but it is present in malignant neoplasia. Here, pleomorphism means difference in the shape, size, and nucleus of a cell. Benign neoplasia is slow growing, malignant is rapid growing. Benign neoplasia is small in size, malignant is larger in size. Hemorrhage and necrosis is less common in benign, and hemorrhage and necrosis is more common in malignant. Benign neoplasia is mobile, malignant is fixed to the tissue. Benign neoplasia remains localized, malignant can be invasive, can infiltrate, and metastasis. Lastly, benign neoplasia is usually non-fatal, but malignant neoplasia can be fatal. Now, a benign or malignant tumor are named differently according to the cell that they arise from. For example, tumor arising from epithelial cells are stratified squamous epithelium, benign tumor of which is called squamous cell papilloma, and malignant is called squamous cell carcinoma. Columnar or glandular epithelium. Benign neoplasia is called adenoma, malignant is called adenocarcinoma. Respiratory passage. Bronchial adenoma, bronchiogenic carcinoma. Renal epithelium. Renal tubular adenoma, renal cell carcinoma. Liver cell. Hepatic adenoma, hepatocellular carcinoma. Urinary tract epithelium or transitional epithelium. Transitional cell papilloma or transitional cell carcinoma. Similarly, tumors arising from the mesenchymal cells such as connective tissue and others are fibroblast, benign tumor of which is called fibroma, malignant is fibrosarcoma. Fat cell, lipoma, liposarcoma. Cartilage, chondroma, chondrosarcoma. Bones, osteoma, osteosarcoma. In others, blood vessels, hemangioma or malignant is angiosarcoma. Lymph vessel, lymphangioma, lymphangiosarcoma. Mesothelium, benign fibrous tumor or mesothelioma. Brain coverings, meningioma or invasive meningioma. Smooth muscles, leiomyoma or leiomyosarcoma. Striated muscles, rhabdomyoma, rhabdomyosarcoma. Here, some cells have no benign tumor but it has only malignant tumor. For example, hematopoietic cells, leukemias, lymphoid tissues, lymphomas. Here, you might have noticed one thing that in case of tumor arising from the epithelial cell, the malignancy is called carcinoma, but in case of mesenchymal cells, the malignancy is called sarcoma. So, what is the difference in carcinoma and sarcoma? First is carcinoma arises from the epithelial cell, sarcoma arises from the mesenchymal cell. Carcinoma occurs mostly in the old people, sarcoma usually occurs in the young and also all age. Carcinoma prevalence is more common, sarcoma is less common. Carcinoma is less vascular, whereas sarcoma is more vascular. Carcinoma has more chances of hemorrhage and necrosis in cut section, but sarcoma has less chances of hemorrhage and necrosis in cut section. Carcinoma metastasis occur by lymphatics usually, but metastasis occurs by blood. Prognosis of carcinoma is less worse, but prognosis of sarcoma is more worse. Now, the very important hallmark of malignant tumor, metastasis. Metastasis is defined as spread of tumor to the sites that are physically discontinuous with the primary tumor. It is an event that marks a tumor as malignant. So, it is one of the most important hallmarks of malignant neoplasm. Now, the question is, what are the other hallmarks of malignant neoplasm? Rapidly growing, poorly differentiated, anaplasia, it has ability to metastasis. Here, once again, anaplasia means lack of differentiation. Now, what are the routes of metastasis through which a tumor can be spread to different part of the body? They are lymphatic spread, hematogenous spread, or seeding of body cavities and surface. Example of the lymphatic spread is carcinoma of the breast arising from the upper outer quadrant generally disseminates first into the axillary lymph node, then into the infraclavicular and supraclavicular lymph node. Gastric carcinoma metastasis to the left supraclavicular lymph node. In hematogenous spread, hepatocellular carcinoma, renal cell carcinoma, follicular carcinoma of thyroid, prostatic carcinoma. Lastly, in seeding of body cavities and surface, carcinoma of stomach or colon may gravitate or metastasize in one or both ovaries transperitoneally, producing secondary tumor termed as Krukenberg tumor. Grading and staging of tumor. We must have heard somewhere once that the patient is having last stage cancer or third stage cancer. So here, what does the staging and grading mean? Here, grading means to divide the tumor according to the degree of differentiation. Grading of a cancer is based on the degree of differentiation of the tumor cell and in some cancer the number of mitosis or architectural features. Grade 1 tumor means more than 75% of the cells are differentiated, means 75% of the cells and structure of the tumor matches and resemble with the cell of original tissue. Grade 2 means 50 to 70% of the cells are differentiated. Grade 3 means 25 to 50% of the cells are differentiated, and grade 4 means less than 25% of the cells are differentiated. Now, staging of a tumor means dividing a tumor according to the size of the lesion and spread of it. The staging of a cancer is based on the size of the primary lesion and extent of spread to the regional lymph node and presence or absence of blood-borne metastasis. The staging of a tumor can be divided in 4 stages considering the size of the primary lesion as well as the presence of nodal spread and distant metastasis. Lastly, after learning about neoplasia this much, let me ask you a question. As we know, the lower end of the esophagus is lined by stratified squamous epithelium. So, if the malignancy, carcinoma, occurs in the lower end of the esophagus, what is it called? As the lower end of the esophagus is lined by stratified squamous epithelium, so if the carcinoma occurs in the lower end of the esophagus, it will be called esophageal squamous cell carcinoma. But if due to repeated gastric efflux of acidic content of the stomach occurs, then due to irritation, the squamous cell of the lower end of the esophagus may be replaced by columnar cells due to metastasis. This condition is called Barrett esophagus. So here, if the carcinoma occurs in the Barrett esophagus, then the carcinoma will be called adenocarcinoma, because as we know, we studied earlier, the malignancy of the glandular epithelium, that is columnar or cuboidal epithelium, is called adenocarcinoma. So that is all for this video on neoplasm. The remaining portion we'll cover in our next video. Till then, thank you so much for watching.